Hello, everybody. Welcome to the second part of our webinar series. My name is Terje, and I'm from Estonia, Kungla Kindergarten. And first, I'll give you a little overview about our PINC project. The PINC project is an Erasmus Plus project focused on making preschool education more inclusive for children with behavioral disabilities. It's a long-term project. It started in October 2023 and ends in June 2026. And the project is a collaboration among organizations from Italy, Spain, Lithuania, Romania, and Estonia. And our objectives are to raise awareness, help educators and parents understand disabilities in young children, share best practices, allow teachers to learn from each other about supporting children with disabilities, empower educators, provide preschool teachers with tools for inclusive teaching, and promote cooperation, support teamwork on inclusion across Europe. Our target groups are preschool teachers, trainers, and children with behavioral disabilities and their families. And our activities are reflection tool, awareness campaign, inclusive best practices webinars, which we are doing right now, open educational resources, training course for preschool teachers, and preschool kit. It was a short overview about the PINC project, and now I'll hand over to today's speaker, Kene Vernik. She is a psychologist and sleep consultant, and she will talk us about afternoon naps. Go ahead, Kene.
So hi everyone, and now this slide should be on full screen, and I hope you see me and you hear me. If you don't hear me, if you don't see me, or you don't see any slides moving on, then please give me like a hand on that. So it's very interesting topic, and I've been talking about this topic in Estonia over 10 years now, and it's a big topic right now, and it's in a change. But I'm a psychologist counselor or counselor psychologist and somnologist technologist. Technologist or sleep technologist means that I actually doing polysomnographic studies in clinics, in hospitals, and I look them over and measure them and just doing all this work. So I've been this in 18 years doing that. And as a psychologist, I do psychotherapy for adults, mainly insomniacs who have a problem with the sleep. And over 10 years, I've been doing educational work in kindergartens, in schools, and everywhere, actually. So, yeah, and I'm using cognitive behavior therapy for insomniacs. So I also full trained to do that. And yes, so mainly I've been working in a private clinic, and half of my years I've been working in a psychiatry clinic, in sleep center. And right now I'm doing work with the children in a Tartu University Clinic and Tallinn Children's Hospital. So yeah, I guess I'm only one in Estonia who is doing right diagnostics for the children who have a problem with the sleep, because we don't have anyone to do that in here. So, but I start with the sleep physiology. I think it's very important to educate you as well about sleep physiology as well, because there's so many things people have to do to really understand why I have to do that or that, because insomnia is actually very behavioral thing. So in children, also we doing changing the behaviors like true behavior therapy actually. So yeah, everything is very behavior. But I guess you already know that we all live in a circadian rhythm. It's a biological clock in our system, and we have a brain. And in the brain, there is a hypothalamus. In the hypothalamus, there is a suprachiasmatical nucleus, which is very important regulator of the circadian rhythm. But the one thing which is helping to regulate this system is light and daytime lightness, which is very important to get. As we know, Estonia is in Scandinavia, in the Baltics, between Baltics and Scandinavia, and we live in a very dark time. Actually, we have 6 months of darkness, and that's why it's important to use also light boxes. It's a lamp what we use in the morning, and in the kindergartens it's very, very highly recommended that all the lights have to be on, and it's good if we have like a really open and very big windows to get more natural light, because the natural light is the first thing what regulates and help us to be in better sleep. So the lightness in the daytime gives you sleep drive, yeah, like a better sleep drive. You fall into sleep quicker. So the melatonin is a sleep hormone, which also very important regulator, but not the most important actually. So there is other hormones in our system help to regulate circadian rhythm, like a serotonin and orexin and adenosine and so on. So yeah, it's like yeah. So, but this in our brain, it is like an internal clock, and it influences of genes is also very great. So it's very, very important to you really look around and look on your parents, how they sleep actually. And also if you have a very bad sleeper, like a child is a very bad sleeper, he don't have any organic problems actually, no sleep apnea or restless leg syndrome and so on. But
sorry,
really sorry,
interrupt? Thank you, Terry.
I'm really sorry, Kene, but we can't see your slides. They are not full screen. Sorry.
We still see the first one.
Okay.
So it's like it's not going on with the slides.
Okay, interesting.
Try to share them again.
Okay, I share now entire screen, and then we see what's happening. But it doesn't let me to share entire screen, so I'm going to share window. I'm going to share it, and now there is a slide. Yes, do you see that slide?
Yes, we can see it, but it's not in a full screen.
It's not in full screen? I don't know how to change that actually. I don't have a problem before with that.
It's okay like this, just when try to change the slide to put another one.
Yes, I'm doing that all the time actually. but
Now we see the second slide. So where is your information about yourself?
okay, I'm gonna do again. Yeah, because it's right now on, but
Try to click on another slide, like the
okay.
third.
Do you see that? Another one?
No.
Right now we see your
No.
introduction.
So it doesn't change because
Now, yes. Now,
Now,
yeah.
yes?
Now it is sleep physiology.
Yeah. So it doesn't actually. So if I put full screen,
Okay, so don't put full screen
yeah,
so we can
I don't
see.
know why.
It's okay.
No, it's not
Important
okay
is
because I don't understand why. Okay.
Maybe you can put this from beginning.
Okay.
Maybe it helps. I don't know. Look from the beginning.
Okay. This is beginning. Right now, I'm changing the slides. Do you see anything? Do you see the
No.
slide? No? Okay.
We still see the sleep physiology.
Okay. Okay. Yeah, it doesn't give me like permission to share an entire screen somehow. Okay, this is entire screen right now. And now I put this full on. Do you see
now,
that?
yes.
Yes,
Okay.
now we see this entire screen.
Okay,
Great.
and you see also I'm gonna,
Yeah.
changing the slides. Okay, okay.
Great.
Okay, I'm gonna do this way.
Thank you, Kene.
Okay, and and what is very important that circadian rhythm is very different individually because we can't compare each other's sleep. We talk about that people should go to sleep like 10 or 11 p.m. and waking up like 6 between 8, but actually it's pretty wrong. And this sleep drive and melatonin and adenosine work is very different because the regulations going on in the cell as well. And we are very different how the regulation in the cell is actually be. So we call it chronotypes, that what kind of chronotype you are, and usually 60-70% of population people are mid chronotypes. That means that they can fall into sleep between 10 and 12 and waking up like a 7 and 8. And there is like a 10-15% of people who fall into sleep later. They are delayed chronotypes, and they are fall 2 or 3 a.m. And some of people are, can fall into sleep earlier, like really like 8 o'clock. But it's very rare that people, in population, usually it's like a 5 or 7% of population can fall into sleep very early. And it's very important notice because children's sleep is also very different between each other. And usually we think that, okay, all the children needs that much and that much, and this needs, all the children needs, I don't know, 2 hours naps before when they are little, but actually it's wrong. So it's very different. So, and of course, we know that there is influencers of sleep as well, like how we behave in the daytime, what we eat, what we drink, what kind of environment we have, and how many times we taking naps, especially children. And now we go to the children's sleep as well. But before that, when the people fall into sleep, they fall into 1 and stage 2, and they fall into deep sleep, which we call it non-REM 3. And this is hypnogram you see on the screen right now. And after deep sleep, after non-REM 3, there is a REM. And so it's like changing. Yeah, it's like stadium by stadium and phases by phases. Like if you're adult, then one phase is like 19 minutes long. So it's like an hour and a half long. And if you're a child, preschooler, then they have usually like an hour and little over that time of phases. So it's like a first, second, and third, and little bit of REM. And REM is this active sleep, we call it, and dream sleep, and related to supporting emotions and mental functions and emotions, especially also the memory. But non-REM, which is very important for the tissue repair and the physical growth, and it's very important for the children. So the first thing what we look on a polysomnographic study, that this child has like normal percent of deep sleep. If he doesn't, then it's a big problem. So yes, deep sleep, and usually if the child is 3 or 4 years old, then he should have like 30-35% of deep sleep. But adults have like a 20-25%, so a little less. And when we go older, then we get less deep sleep and less REM as well, but not that much. So REM containing to be like between 20-25% of sleep. So, and children's hypnogram is a little different. When we talk about preschoolers and like a 2 or 3 years old children, the deep sleep is also might be in the morning time as well. Usually adults, the first half of the sleep, they sleep more deep sleep, and the second half is more REM and first and second stages. But preschoolers, they have a more like mixed up, so they sleep this deep sleep also in the morning time sometimes. And if they are sleep deprivation, then of course the body takes more deep sleep. Otherwise, the child behavior is changing, and also the growth tissues are how to say, like broken. So, and here is a formation of the child's sleep, like a third step, like a 3 steps. Of course, there's a lot of changes going on if the child is growing. But in the first months of life, the child sleep is mainly active sleep. There is no deep sleep, and we don't recognize REM actually, even though they have REM, of course, if they even if they are if they haven't yet born. But sleep is not yet very regular, and there is a really unformed sleep-wake rhythms. So the circadian rhythm is not precise, and it's important that the first of 3-4 months we don't do anything with the sleep actually, because it's not ready to do anything. But after that, we can regulating a little bit, and regulating changing the naps, of course. From the 4th month of life, daytime naps becoming more regular, as I said, and when average, they're up to 3 naps per day, and they are able to sleep through the night. So in the first year of life, the child's night sleep becomes more formed, and the frequency of awakenings decreases. The child can sleep for 10 hours in a row and so on. So, yeah. And the big change is going between 3 and 5 years old, when they are ready to remain completely in the period of the night sleep, actually. Because by the time we see that the sleep architecture is very similar and already formed, and they have a very good circadian rhythm, it's of course if they have a good sleep hygiene and routines and so on, and all the homeostatic process of circadian rhythm have a full developed. So this is the time when we see that actually 60% of children don't need any naps anymore, and they don't do naps. And we should give we should not regulate over the naps, or should not regulate over the nights and daytime naps and sleep. It's very important to let them free on that time. And here is we using Principle and Practice of Sleep Medicine 5th edition. I'm using that actually, but the American Sleep Association giving us new criteria every other year. So you see, like 1 to 3 years old, they need like 10 to 16 hours. So it's very, very large a range. We don't have a precise hours, because we never know how much this child needs, because it's very individual. And yes, they need a nap, like usually 1 nap in a day. And usually it's like hour long, not over that. And maybe 1 and 2 years old, they need little bigger naps, like 2 hours and so on. But 3 years old, usually they need 1 cycle of nap. It's a 1 hour nap. So, and here you see like a 3 to 5 years old, they need like 11 to 15 hours, and 50, some cases 60% of 3 years old don't nap anymore. And after 5 years old, of course, they don't need naps at all. And they need a long, normal night's sleep, and no wakenings. And of course, I'm telling people that 10 to 13 hours is the best. 9 is still very, low, actually, if you don't do the naps, if you're 5 years old. And this is very old study by the FaceBlood, and it's a meta-analysis, actually, but we see there's a month, how old the child is, like 6, 9, 12, 15, 18, so on. And we look more into this 36 and 89 months old, so 3, 4, and 5 years old. They do this 1 nap, and usually the nap is under 1 hour long, usually even 30 minutes maybe. And so we see how the naps are changing by the age. So this is maybe it's a nice overview, I think. And the meta-analysis, what Trophy suggests, is that from the 2nd year of life, children could get all the necessary rest from the night sleep, and the sleeping longer during the day is rather an indicator of the poor sleep and quality at night. And this is what I see every day. And there is another study which is also good to see, good overview. Children who nap later, like the nap time was later. This is the 2nd picture, lower picture, actually. So they went to sleep like 3, 4 p.m. We know that if you do the later nap, you fall into sleep later, much later. So they are very young children in here, 1.5 years old. And children who napped earlier, so they went to taking the nap like between 11 and even 12, they went to into nocturnal sleep between even 6, between 8 in the night. So of course, I recommend to nap earlier. Otherwise, all the parents going mad inside, because it takes a lot of time to put this child into sleep, and if they do very late naps. Children sleep in kindergarten with naps 4.4 years old, and total sleep is 10 hours, and the length of the night is 9.5, and average nap length is 1 hour. So this is very similar with Estonian children, what's going on in Estonia. If you have a 4 years old doing this 1 hour nap, so he has only 9 hours, 9.5 hours sleep, which is too short, I think. And they also have more awakenings during the night if they do this long nap. And children who did not nap during the day slept more peacefully and slept longer at night. So this is basically the same, like I said before. So, and here is consequences of sleep deprivation issues. So we go to these behavioral things. Of course, the more problems with behavior and emotion regulations appear if our children have a sleep deprivation going on, so they don't get enough sleep, especially night sleep. And they have more internalized, so the emotional problems. So they can't regulate emotion that quickly, and they are more out and externalized. So all the behavior problems are appearing. They are more behavior problems than can affect their development. So this is very old study actually, and children aged 3 to 5 years old who took daytime naps had more night sleep and significantly shortened and many awakenings. So actually what we see that children who taking naps after 4 years old, they have a shorter night sleep and they have more awakenings. And I have to say they are more they feel fatigueness and sleepiness much quicker in the daytime. So because they have such a short night. But if they don't do those naps, then the length of this night sleep increases, and this is, the thing what we want. But this is important point that if you are younger than 3 years old, so here is a study like a 36 months old children, we see that it turned out that children's emotionality decreases in case of complete nap restriction. The children in the study were shown pictures with positive and negative undertones, but their reaction had become lower. So they don't react anymore in high emotions. They are more like neutral, yes. So this is only one study, I have to say, because in a world of sleep medicine, there is no much studies about the naps actually. So this is it actually, what you see, and this is important point that under 3 years old children need naps, of course, very important. Otherwise, they are changing as well. And the study pointed out that the daily sleep requirements, like 1.5 years old, are important, and after 4 years old had dropped the need of naps, and it's important that they don't do those naps anymore actually, because of the behavior issues in the daytime. And other way around, it's important to really, like I said, it's important to give free regulation, free sleep regulation for the child, if the child is 3 years old, and see how much he needs the naps or not. Usually they do sometimes the naps and sometimes not, and so on. And it's like a 1 year formation going on in the body. And after 4 years old, when they are 4, they usually don't need the naps. And there is a self-regulation thing as well. And on average, the sleep of 3 to 4 years old children is regulated, and its connection with this they need for the daytime naps decreases or is completely absent. So this is just to point out. And continuity of daytime naps or their excessive prolongation by result is, like I said, resistance to going to sleep at night. This is the main problem, because we like forcing them to let them forcing them to sleep, but actually they are not ready because they did a very long nap. In Estonia, they do 2 hours nap. So also the 6 years old and 7 years old. So yeah, so it's crazy, I know. So we have a regulated system. We have a very stiff regulated daytime nap system, which continuing when the child is 7 years old and finishing the kindergarten, and then they go to school, and then they don't have to do the naps. So after all, like what I said, all the children, actually, not all the children who are doing the naps after 3 or 4 years old, the many have problems with the night sleep. But we know that if you have a short night sleep, then you need a nap in the daytime, yes? So they doing the naps because they don't sleep monophasically, they sleep polyphasically. So they do a big long nap in the daytime and they have the short sleep in the night. So it's bad. So, and they have a disturbed sleep, awakenings, and the child may experience sleep deprivation due to the shortened night sleep. So at the end of the day, those children are in a sleep deprivation, actually, and they need a nap. They need a nap. They need a nap, and they are exhausted too quickly. They don't have energy all day long. They have energy maybe only for the 4 hours, and they do the nap because of the short night. When we take daytime nap off, then we see result that actually this short sleep is, prolonging and increasing, and we see that if they do the 11 or 12 hours night sleep, they don't have a problem with the motion in the daytime. They don't tired, they are not tired that much, they don't need naps, of course, and so on. So this is like a logical thing. And the main problem, yes, is overregulation of children's sleep time and not considering the individuality in our system. And this is mainly in the Baltics as well, the problem in Latvia, in Lithuania, and also all the countries who were in Soviet Union. So yeah, it's a big problem. In other countries in Europe, they don't have that problem because they don't do the naps, that kind of naps, like 2 hours sleeping in a bed with pajamas. They do this quiet time things in Norway, in Germany, in Finland, and so on, in America, in Australia, and so on. Yeah. And I just pointed out that according to self-regulation theory, an organist would individual sleep rhythm best for overall health and functioning. So the body, a self-regulating system that helps the body move enough and eat correctly in an important factor in a person from the standpoint of general health. So also this self-regulating system is working better if we don't, over-regulate the sleep. Otherwise, this regulation system also fluctuating, all the eating habits, physical activity, and so on. So insufficient sleep or nap lengths then ignore natural needs can reduce the ability to self-regulate. So yeah, I like this theory by the higher, and I recommend to, although if you have an interest about those things, then you can see the studies. So let's continue. It's very slow. So when do naps end completely? I just put this point out. So 3 to 5 years old, usually they don't need the nap, but there is a changing going on. So it's like between 3-5 years old, like 60% of children are coming off from the naps if it's freely regulated. And problem with the long daytime sleep, like I said, the night sleep is restless with awakenings. The child has strong resistance to night sleep. Parents are anxious and stressed in sleep. In a hospital where I work, I think 50% of parents are coming to me because of this resistance of the night sleep, because of the long nap in the daytime. And yes, we take a nap off and this resistance actually is gone. And there is less stress for the children and child and less stress for the parents. So yeah, this is the first thing what we do. And also the resistance to daytime sleep. If we're forcing child to sleep, forcing doing this kind of behavior, of course the child have a stress with that, and the resistance continues in the daytime naps as well. So sometimes teachers are mailing me like how I put this child to the sleep. He has a high resistance and crying and doing all the stuff. I said, please don't put it in the sleep. He don't want to go to sleep, especially when he's 6 years old. And children get tired faster, like I said, and they are more stubborn, outrageous more. And there are more episodes of sleep panics. Yes, the sleep panic is a sleep disorder, in a deep sleep disorder. It's a very genetic, but I have to say, but if the child is in a sleep deprivation, he has a short night, and it's chronic. It's like 2 years and 3 years. In our case, they have a 5 years deprivation. Then these episodes can occur. And I've seen that a lot. And I'm taking off the nap child who have a sleep panic, and the sleep panics are disappearing. Yes, this is the easiest thing to do. And of course, it's genetic, and of course, the sleep panic can be connected with the stressful life events and with the parents and so on. But in Estonia, mainly, the problem is the naps. The child has been given melatonin or valerian and other drugs, and all sorts of lulling techniques are tried. So yes, the parents are coming and they're saying that they are giving to the melatonin to 3 years old or 4 years old, that they can fall into sleep quicker in a night, in the evening, around 8 or 9. And I saying like, oh my God, don't do that. you can't force them to sleep because the sleep drive is later in this child because he's doing the big long naps. And I have to say that long naps are between 1 and 3 p.m. So they are very late naps. Like I said before, late nap, late fall into sleep in the evening as well. And it's crazy. I have to say it's crazy. So, and they're giving the melatonin. So we don't have a longitude studies about melatonin and children, actually, longitude studies we don't have in a sleep medicine. So I'm very, very bad. I don't like to give melatonin, but people doing that. If you have if you have a circadian rhythm, the child has special needs children and pervasives, and some of them need melatonin, but norm child doesn't need that. And here is a overview, just an overview of sleep disorders. I think it's very important that school teachers and kindergarten teachers should knowing those things. Like if she hears that this child is snoring or the mouth is open, so this is not normal. Yes, this is sleep apnea, we call it. This is a symptom of the sleep apnea. And the mouth breathers, there is I have to say statistically, there's like a 20 children in a group, and there is 3 or 4 mouth breathers usually. So it's a very high. And it's very bad that we on children breathing through the mouth. It's not good. We see a lot of micro awakenings in the brain. On a study, we see that there is not enough deep sleep and REM, so the sleep is also fragmented, and those children are usually very sleepy, and they really need daytime nap because the night nap is short and fragmented, and the quality is very bad. So yes, it's an issue. So in the children, we do a BSG study, of course. It's a sleep study, and yes, we operating adenoids, or doing all the things what we have to do to open the canals that they can breathe actually. The very common issue is parasomnias and sleepwalking and confusional arousals and sleep panic. They are all in a deep sleep issues, and it's a very high prevalence actually. So preschoolers, it's normal that they are walking and talking and they have a panics. It's connected with growth and development, and like a fast development issues in the body, and it's very normal thing to do. It's normal. But if it's dangerous for the child or the other ones, then of course we do the changes and see. But in our case in Estonia, we have a problem that it's this behavior is too long because our children are in a sleep deprivation. They are stressed actually, and they have these sleep behaviors too long, persisting too long, and usually they are like 2 or 3 years. It's okay if your child is behaving like 3 months or weirdly, or even half of year, but not like a year or 2 years. And yeah. And yes, we in the parasomnias, we increase total sleep time. It's the first thing what we do, scheduling awakenings, bedroom, safety counseling, all the sleep hygiene issues, screens, everything like that, we look over. The sleep terror is sleep panic, like I said, and also increasing the total sleep time is very important. And some children have nightmares as well, which is very common and very, very normal because they regulate emotions in our REM as well. So yes. And like you see on this picture, the treatment options are the last one. So, and epidemiology is first, and clinical features and the diagnostic criteria. So, yeah, we all use them in a hospital, and it's very important to use right diagnostic equipments. And also, the one thing I want to just say that's restless leg syndrome is also very common. In here, prevalence is 2%. But I have to say, in a children's hospital, I've seen a lot of children who have a restless leg syndrome. It's a neurologic disease, and it's we need diagnosed by history. We need usually use also polysomnographic study, and sometimes yes, if the child is 6 years old, we can give also the pramipexole, which is one cure, and yeah. So the restless leg syndrome is like you have an urge to move the legs, and we know that children can be very active in a bed. And if I see the child and he's very restless, also in appointment, then of course I ask those questions, and of course, and I see that he's very restless. It doesn't mean that he has like a attention problem, and it's very important to do the diagnostics in here. So in the children, they have to have a solid sleep routine, a ritual at home that also ensures the good sleep. Even though if we take off the nap from the 3 years old, then the routine is very important. And also we have to deal with the sleep associations as well. Sleep association means that if child needs something, some behavior to fall asleep, like rocking and singing continually, and doing some behavior from by the parent. But this is also very bad for the child, because in the nighttime they have a very restless sleep, and they are waking up all the time in the middle of the night, controlling the parent, controlling this behavior, that I need this behavior, and the parent kills that behavior. I've seen a lot that the parents are giving breastfeeding to the child who is 4, 5, or 6 years old. Nothing comes out, of course, but just it's a sleep association to really try to, for the falling the child asleep. So yeah, this is also a very big issue actually, and a big thing. But in here you see what we should do at home. The solid sleep routine, reading the book, talking about the day, wishing good night, and the child should fall asleep in the same place every night, of course, in a room that it's quiet, cool, and dark, and without the screens, of course, and quiet hour before bed, usually between even at starting like a 6:30. When we don't have a nap for 3 or 4 years old, they should go to sleep like around 8, even before 8 p.m. So we're starting pretty early. And it's a big issue in Estonia because our work days, our work time is so long, and they don't have a time to put the child to sleep around 8. They have a time maybe in a 10. So, but I think it's not right. And here is like sleep hygiene, things and certain rhythm of sleep and wake up at the same time, even the children, of course, also in the weekends. And we see the problem that in a weekend tends to break the routine, as we see when we are adult as well. In addition, the naps are not taken with the child. That means that they're doing the naps in a kindergarten because it's forced and it's a routine. But in the home, they don't do the naps, of course. And when they go into the kindergarten at the beginning of the week, the child tired and exhausted and doing the nap. So it's a very irregulated sleep pattern, which develops sleep deprivation, and then sleep deprivation issues on behaviors of the child is very excited HDA child. So yeah. And the solid sleep routine activities before sleep and problem can be very different from kindergarten. So it might be that kindergarten have a very good sleep routine, which is right. And they have a very solid routine before the nap. But in a family, in the evening, they don't have nothing, and they have a problem with this. And the child is confused. What we do here? Are we watching the TV or are we doing the sleep routine? So yeah. And the sleeping environment must be dim, dark and quiet, definitely clean of toys. It could be the same in a kindergarten. And children should not be given too much water or any other things before going to bed, because and the child should always be put to the bed while he's still awake. It's a recommendation, but yes, you can put them to sleep and reading the book, and then you just wait when he falls into sleep. It's also very okay. But otherwise, he will not learn to fall asleep on his own, which is connected with the regulation system. And the toddler has a repeated awaking during the night. He should be comforted and put to sleep in his home bed. So if the child is coming out all the time in the middle of the night, usually parents are taking them with them, taking child to them in day bed. But this is not good. then you ruin everything what you've done. So you don't take the child in your bed. You go to the child in his bed and waiting when he falls asleep. And if there is a flu or he's ill, then also we are going to the child bed, but not we taking the child with us. So it's very hard to change that after illness. And yes, there is a toddler has repeated awakenings. So this is also comforted and put to sleep in his own bed, but not cuddling and rocking and waiting. And this is also, like doing some behavior every day. So it's not good, because the child starting to control that, starting to needing that in the middle of the night as well, and waking up the body and screaming, "Mommy, where is your breasts? Where is your breasts? I need them." Like a 7 years old. Yes, I have cases with very old children breastfeeding, and because of the bad sleep association. So yeah. So there is an overview of cases in the hospital, and just to show you, this is a 7 years old boy. The pediatrician refers. We see that EEG is norm and a poor sleep since birth. Episodes of sleep panic lasting 1 to 2 years, like I said before. It's very common in Estonia. that children have a very long sleep panic attacks and crying and standing up, and sometimes they are doing this head rocking and so on. And the parents are using noise machine and so on. So our intervention is adjustment of sleep routine, educate about the night behaviors, take a nap off, and put the child to the sleep 8:30, and also all the cars and noisy machines are forbidden. So, and we see the feedback is good, stable sleep, reduced crying, and reduced sleep panic episodes. And actually, it's connected with the nap. This is the first thing what we took off. 7 years old, doing the naps 2 hours in a day. 6 years old, the pediatricians refers epilepsy and getting treatment. And falling asleep in a problem does not calm down, falls asleep 2 hours around and falling asleep like 11. A brother in the family, the sleep is same bed with the mother. And intervention is correction of the sleep routine, independent sleeping. So we're doing this behavior therapy and taking off the nap. And the 6 years old is good to go to like between actually 8 and 9, but that all children, it's like around 9 usually. And feedback, peaceful sleep, no awakenings, falls asleep well, sleeping in their beds, everything went well. It's only 2 sessions doing that, and everything went, correctly. And this is like everyday case. Like a child is 3 or 4 years old and falling asleep is a problem, does not calm down, the same. It takes time, and the children's sleep is restless, episodes of sleep panic occurs, and so on. Intervention, the same, correction of sleep routine, taking nap off, and feedback, peaceful sleep, no awakenings, falls asleep well, sleep panic decreases. And this is like when I have 10 patients in a day in a hospital, and there is usually 5 patients who have the same problem. So there has to be one reason, and there's a nap, too long naps. So yeah, this is it. I know I talked maybe really like roughly, and my English is not the best one right now, but I hope you did understand what I said, I thought. And this is a big issue in Estonia and the country where in the Soviet Union, and no problem in Europe actually. And like I educate you about the sleep physiology, then yes, children are ready to get off the naps between 3, 4 years old.
Thank you, Kene, very much. But now does anybody has some questions? Okay.
You can also write in the chat.
Yes, you can also write in the chat. It's very good to see those questions in the chat as well. And I'm going to open up the chat room. Okay, I can't open because I am not admin. I can see that. So, yeah. But if there's a question, I'm here. If I have a question to you, do you have the similar problem in your countries or not?
Yes, Alexander.
Okay, I can say about my personal experience from Serbia, and I know that it's quite similar situation to what you explained. And there will be also a question. I know that a lot of teachers are not forced, but advised, let's say, to put children to sleeping or napping for quite a long time, and even to force them to do so in the afternoon. So having all this in mind, what would be an appropriate maybe reaction when some of the things like that occur before we got to change something?
Yeah, children, teachers are very like strict about this and very conservative about this, and because they've done that over 100 years, and at that time we didn't have any studies about that, and the system is still very, very old. And actually, we know already like 40 years now that no naps in that old children. And yes, should a child with conduct disorder and impulsive take a daytime nap? It depends. It's very individual. Like I said, it's with the special children, special needs children, and behavior problems or development problems or paralysis or autistic. It's very individual. We have to see what kind of sleep is okay for him, and then if it's necessary, we try to do naps. But usually I have to say that in the case of impulsive children, actually they don't need naps, but they need a long sleep. And usually they want to sleep in the early morning and in the morning time. So this is the big issue, because it's the social norm is that they have to wake up very early to go to kindergarten. But this is forbidden for them, I have to say. I see that in a children's hospital, that if I take off the first like 2 hours in the morning, and I'm giving the sleep for them, so we give the free time, free regulation, then we see that they have a longer night and they don't need a nap. But it depends of the age as well. So yeah. And what do you suggest to kindergartens? How should we help kids to stabilize their nervous system? Okay, this is to say, this is a weird question, I have to say. It's very individual. What's the problem, and what is the schedule of this child, and how much he sleeps, and everything begins with the sleep. And we see how the sleep is, and then it's okay, and then we see that what's going on with the nervous system. So
okay. I was the one who asked the questions, and I asked it because you said that kids after 4 years, they do not need the nap in kindergarten. So in kindergarten, they get really overstimulated. There are a lot of people around them, and if they don't have a nap or just a stop where they can lay down, just so their nervous system can like restart. So what's your suggestion?
yeah, of course,
then?
they have a quiet time, like in the West countries have a quiet time. So the quiet time is 45 to 1 hour long. 45 minutes to 1 hour long quiet time, where they can rest, where they can be doing the sort of easy exercises. And yes, of course, they need rest, but it doesn't mean that they need a nap. And they have to do the pauses, they have to do this quiet time things. Of course, this is recommended. And in Estonia, we still we're gonna let them to sleep 1 hour, and right now it's 2 hours, but we're gonna change that, and we let them sleep to 1 hour, so it's okay. and because the social norm, the parents and the teachers are not ready to give them only quiet time, and so the naps are staying in Estonia, but they are shorter and a little earlier. They're doing the naps early in the day, not in a 2 to 3 p.m., but around 12 and 1. So it's okay. But yeah, so the quiet time.
And Kene, there is another question too.
Would the child quality of sleep be affected if, for example, parents are divorced, so they spend some nights at the mother's house and other? Yes, of course. Yes, of course, it can affect it, emotionally affect it, and behavior as well. It depends how the parents are putting the child to sleep and what are the daytime routines, behaviors, habits, and they have to be similar. Then it can be okay. It's changing. But usually, if the parents are divorcing, then the father is doing his routines, the mother is doing hers, and this is sometimes very different, and this is very confusion. This is a big confusion for the child, so we don't recommend to. And sometimes I have to do the advising them that really do the psychotherapy for the parents that please we have to have a similar behaviors for the child, otherwise we can't do anything. And everything depends with the parents' behavior, of course, and affecting child emotions and behaviors. Is there a way to minimize the negative effect in this case?
Sorry, this question was it was referred to the. Oh. Sorry.
Yeah,
So, this question was referred to the previous one, but you already replied your answer. Thank you.
Yeah.
I have a question. Like you said, in Estonia, it's a pretty big problem, this daytime naps. What is your suggestion to change it? Should we start from the kindergarten, or should we start from parents?
We're starting with the kindergarten, of course, because this is the main problem right now. And of course, we educate parents as well. But the kindergarten daytimes regulated system is changing the night sleep. And IDEFIX study, the big study in Europe study, we see that Estonians children are sleeping the most, less, and it's connected with the nap time. So yeah, this is the first thing, and then hopefully that the parents are coming with it and doing the better sleep routine and sleep hygiene and so on. But yeah, because it's a behavior, like I said.
I just want to share you that in our kindergarten we started this. We took often naps in 6-year-olds, and it was really actually amazing, like how parents were so frustrated. Why can't they sleep anymore in kindergarten? And it was for me, actually, it was like, wow, I didn't imagine that they can be so frustrated about it.
Yes. In Estonian parents, they are also, they don't know what's going on with the physiology. They don't know how connected with the night sleep. And also they want to longer days with the child, because if you take off the nap, then you have to put the child to the bed earlier. but parents are coming home very late, and this is the main problem, I guess, coming up. But like I said, we don't take often naps anyways, but I have to this have to change anyways, that the children in Estonia have so long kindergarten days and the teachers have so long days. I think it's not right if you do the child. If you give a birth of child and giving to the kindergarten for 11 hours or for 10 hours, then who you are, what kind of parents you are, then the teachers are the parents. And right now in Estonia, I think it's not okay, and we have to change that, and we start to somewhere, some point.
Does anyone has a question? Or maybe you want to share your experience. How is it, like, can I ask you, how is it in your countries? Maybe somebody wants to explain it.
In Italy is very different. I think there are not a strict rule in kindergartens. So there are some kindergartens who include a small nap, let's say, after lunch usually. Some others who are maybe organizing some relaxing moments, as you were saying, Kene. So it's more like reading a book together or individual activities. So to a bit relax the child mind, let's say. So let's say that it depends a bit on the kindergarten. There are not some rules from above, let's say. But it was very interesting to hear about all this sleep information, I have to say. So thank you for your contribution, Kene.
Thank you.
I have one more question. What do you, can I think, why is it like this in the Soviet Union countries? Why we are so wanted this daytime naps?
I think it was like in the year of 55, they took that rule. And it's a political rule, I think, because people had to do long work days, and our babies were in a night shift as well. They were in a night kindergartens in Estonia. That was changing in the 90s, in early 90s. And so children were growing up in the kindergartens, and because the parents did work all the time. So this is it's a political thing, and it's not based on studies and anything, but it's still on in Estonia. So I think it's it's very bad. I don't have a word for that. And yeah.
If there are no more questions, we can close the session. Of course, you are all very welcome also to write if maybe some more questions arise later on while you are reflecting tomorrow and the other days. You are always welcome to write to the email address that I sent. Before closing, of course, I want to thank you, Terry and Kene, for their contributions and their interventions. I will send after the webinar all the slides, so that you can have them to review and to share, of course, with your colleague. And I'm also sharing now, 1 second, the screen to let you know which are the next webinars and their program, let's say, because we have updated a bit the program. I will also send you this by email, maybe, so that you can have it. So the next webinar will be held next week, the 6th of November. The time is always 3, of Central European time. So as always, make sure to check your time zone, let's say. And the topic will be adapting learning materials and activities for diverse learners. And then we will have the last two webinars, one the 14th of November, and it's about promoting inclusive environment for everyone, for every children. This time it would be at 2 Central European time, so 1 hour before. And the last webinar will be the 15th of November always, and it will be about addressing and preventing bullying and discrimination. So very important topic as well. And the time is always 2 p.m. So this will be the next webinars that we are having. So if you are willing to participate, of course, you can register. I will send you again the registration form. So I can close this. And lastly, as very last thing, I will also send in the chat a small evaluation form, which is very useful for us to collect, let's say, your feedback on all the webinars. So you can fill it in by leaving any comment that you have, which of course will help us to improve for the next sessions. So you can fill it in also later on, but you can open it from the chat so you can save it. So once again, I thank everyone for participating, for your contributions. And of course, I hope to see you soon in our next sessions. Thank you, everyone.
Thank you. Bye.